Allergy prevention and response. An allergy is an immune response that causes antibodies to respond to allergens. The immune system is the body's organized defense mechanism against foreign invaders or allergens. These allergens might be pollens, plants, medications, animal dander, insect stings or bites, food, especially nuts and shellfish. The immune system, designed to protect us from illness, produces symptoms that can make you feel sick when it overreacts to mundane substances. Allergies are the reaction or overreaction by your body's immune system of a non-dangerous substance. This reaction can be anywhere from mild to severe. Common symptoms are hives, nasal congestion, itching, rashes, watery red eyes. Moderate to severe reactions are weakness, dizziness or lightheadedness, fear or feeling of apprehension or anxiety, flushing or redness of the face, nausea and vomiting, cramps or pain in the abdomen, diarrhea, chest discomfort or tightness, difficulty swallowing, difficulty breathing, palpitations, swelling of the face, eyes or tongue, wheezing, and unconsciousness. For first aid for mild to moderate reaction, you identify the allergen trigger and have person avoid further contact with it. If from a bee sting, scrape the stinger off the skin with something firm such as a fingernail or plastic credit card. Do not use tweezers. Squeezing may release more venom. If an itchy rash or mild inflammation around the site develops, apply cool compress. Watch for signs of increasing distress. Get medical help if there are any questions or concerns. Send a student to the nurse even for a mild reaction. Check the person's airway for breathing. A warning sign of dangerous throat swelling is a very hoarse or whispered voice or a coarser sounds when the person is breathing in air. If no movement or breathing at all, you should start CPR. Have someone quickly call 911, the nurse, and the principal. Always call 911 with a severe reaction. If the reaction is from a bee sting, scrape the stinger off the finger with something firm. Remember, do not squeeze the stinger. Some high-risk students have permission to carry an EpiPen, which is epinephrine. Have them administer it if they can. If not, help them administer it. Know that there are adult and junior EpiPens located in all health office emergency bags. The health office EpiPens will have a list attached with student staff names who cannot have epinephrine. Always avoid oral allergy medication if the person is having trouble breathing. If the student is carrying the EpiPen, it should be the right dose for their age and weight, but if one is used from the emergency bag, the dose should be as follows: 0.3 milligram for patients weighing over 66 pounds, 0.15 milligrams for patients weighing between 33 and 66 pounds. Anyone under 33 pounds, call an ambulance and give CPR if needed. While waiting for an ambulance, take steps to prevent shock. Cover them with a blanket or coat. Have the person lie flat and raise the person's feet about 12 inches if they are not in pain and if they do not appear to have any head, neck, back, or leg injuries. When ambulance arrives, tell the ambulance driver when the reaction began, the times and doses of epinephrine that were given, and what caused the reaction if you know that. Read District Policy JHCF and JHCF-AP on the district website. Staff members must submit a list of students taking part in off-site activities to the nurse at least 5 days prior to the activity. Staff members shall not use air fresheners, oils, candles, or other such items intended to add fragrance in any district facilities. Staff members are prohibited from using cleaning materials, disinfectants, pesticides, or other chemicals except those provided by the district. Staff members supervising dining areas will promote a no sharing or no trading environment to prevent students from trading foods, beverages, or dining utensils. Before serving any food or beverages on district transportation, the sponsor must verify that none of the students have documented life-threatening food allergies.
This is the EpiPen auto-injector. It comes in 2 strengths, one that's for patients weighing 66 pounds or more. As you can see, it has a yellow label. And one for patients weighing 33 to 66 pounds. That's EpiPen Junior. It has a green label. Whether you have an EpiPen, EpiPen Junior, or both, it's important to remember to refill your EpiPen prescription before it expires. You can find the expiration date right here on the auto-injector. Also, take a look to make sure the solution inside the EpiPen is clear and not discolored. And since it's important for you to have 2 EpiPens on hand at all times, EpiPen and EpiPen Junior come in 2 packs. Each 2-pack also comes with a training device. Even if you carry an EpiPen everywhere you go, it can only help you if you know how to use it correctly. In a moment, I will show you how to self-administer an EpiPen. You can follow these steps whether you're administering EpiPen to yourself or are a caregiver administering EpiPen or EpiPen Junior. So to get started, begin by removing the EpiPen from the carrier tube by flipping open the cap and then tipping the tube and sliding it out. It's important that you don't place anything in the carrier because this may prevent you from removing the EpiPen when you need to use it. Once you're ready to use the EpiPen, start by grasping the unit with the orange tip pointing downward. The needle comes out of the orange tip, so make sure you never press, push, or put your fingers or hand over it. Next, form a fist around the EpiPen with the orange tip down, and with your other hand, pull off the blue safety release. To inject, hold the orange tip near your outer thigh. Then swing and firmly push against your outer thigh at a 90-degree angle until you hear the EpiPen click. The EpiPen is made to work through clothing. Continue to hold the EpiPen firmly against your thigh for approximately 10 seconds to deliver the medicine. Now that the injection is complete, remove the EpiPen and massage the injection site for 10 seconds. Most of the liquid will still be left in the EpiPen after you finish the injection. Once you've used the EpiPen, it's important to call 911 and seek immediate medical attention. Then, place the used EpiPen back in the carrying case. As you'll notice, the cap of the carrying case will not close after the EpiPen has been used. And lastly, make sure to take the used EpiPen with you to the hospital emergency room. To properly dispose of expired or used EpiPen units and carrier tubes, make sure to take them to your doctor's office or to a hospital. A used auto-injector with an extended needle cover will not fit in the carrier tube. Important safety information. EpiPen auto-injectors contain a single dose of epinephrine, which you inject into your outer thigh. Do not inject intravenously. Do not inject into your buttock, as this may not be effective. In case of accidental injection, please seek immediate medical treatment. Epinephrine should be used with caution if you have heart disease or are taking certain medicines that can cause heart-related cardiac symptoms. If you take certain medicines, you may develop serious, life-threatening side effects from the epinephrine in EpiPen auto-injectors. Be sure to tell your doctor all the medicines you take, especially medicines for asthma. Side effects may be increased in patients with certain medical conditions or who take certain medicines. These include asthma, allergies, depression, thyroid disease, Parkinson's disease, diabetes, high blood pressure, and heart disease. The most common side effects may include increase in heart rate, stronger or irregular heartbeat, sweating, nausea and vomiting, difficulty breathing, paleness, dizziness, weakness or shakiness, headache, apprehension, nervousness, or anxiety. These side effects usually go away quickly, especially if you rest. Talk to your healthcare professional to see if EpiPen, epinephrine, or EpiPen Junior, epinephrine, auto-injector is right for you. Indications. EpiPen and EpiPen Junior, 0.3 and 0.15 milligrams epinephrine auto-injectors are for the emergency treatment of life-threatening allergic reactions, anaphylaxis, caused by allergens, exercise, or unknown triggers, and for people who are at increased risk for these reactions. EpiPen and EpiPen Junior are intended for immediate self-administration as emergency supportive therapy only. Seek immediate emergency medical treatment after use. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information about EpiPen and to sign up for expiration date reminders, visit EpiPen.com.
Oh, hey, I'm Ben. And this is AviQ, the first and only epinephrine auto-injector with voice instructions for adults and children with severe life-threatening allergies. Did you get all that?
Good. Now, in case of an anaphylactic emergency, here's what you do.
First, pull AviQ out of its case.
If you are ready to use, pull off red safety guard. If not ready to use, replace the outer case.
We're ready. Okay, red safety guard, give it a good pull.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
AviQ should only be injected into the middle of the outer thigh. Also, feel free to leave your pants on. AviQ will still work. How will you know it's working? You'll hear a click, then a hiss. The needle will retract on its own.
But remember, do not remove AviQ until the 5-second countdown is done.
5, 4, 3, 2, 1. Injection complete. Seek emergency medical attention. This device has been used and should be taken to your physician for proper disposal and a prescription refill.
Seek medical attention immediately afterwards and have a doctor check you out. And that's it. I hope this helped. And don't forget to always keep your AviQ on you.
Know your steps. The ABCs for successful injection. Injecting on behalf of another. This video is intended to provide instruction on how to use the Adrenaclick epinephrine injection autoinjector. The patient and caregiver, if possible, should practice and watch this video carefully before using Adrenaclick. It is best practice to check the Adrenaclick often. Look at the medicine in the Adrenaclick regularly. If it looks cloudy, has particles in it, is discolored, or if the expiration date has passed, the Adrenaclick unit should be replaced. Do not remove the gray caps until you are ready to use. When ready to inject, complete Step A. Pull off gray end cap marked with a 1. You will now see a red tip. This is where the needle comes out. Never put a thumb, finger, or hand over the red tip. Next, pull off gray end cap marked 2. Step B. Put the red tip against the middle of the outer thigh. Press down hard and hold while counting to 10. Adrenaclick's needle can go through clothes. Remove Adrenaclick from your thigh. Check the red tip. If the needle is exposed, you receive the dose. If the needle is not visible, the dose was not administered. Please repeat Step B. Carefully put Adrenaclick, needle first, into the carrying case. Put the light gray case top over the non-needle end of the Adrenaclick unit and close the case. Step C. Call 911 and seek immediate medical attention. Give your used Adrenaclick to a healthcare worker for proper disposal. Do not throw away in a regular trash can. It is essential to practice and become familiar with your Adrenaclick. For more training information or to order a product trainer, please go to adrenaclick.com.